To me, public health is what keeps the general public safe with or without their knowledge. It's the collective organization of wellness and prevention campaigns that promote a healthier general well being of human life. It's the education, information, and research that goes into the big picture of health as opposed to the individual treatment a medical doctor would give. Public health covers a wide range of areas, including behavioral health, mental health, disaster or crisis response, environmental health, and injury prevention. The importance of public health lies in the many areas that it covers. Because it covers so many diverse areas and diverse groups of people, issues need to be addressed with some generality to make sure everyone has access to the resources public health professionals provide. Without the work done by a public health professional, one may not be aware of any negative influences that may be in their surroundings. Public health makes people aware of their surroundings and reduces their exposure to any risks they may encounter. It's anything from the flu shot campaigns to Ebola control strategies. It's the readiness plan when you hear about the approaching major storm. It's a program to reduce bullying in schools. It's ensuring your child's daycare is safe. An example of public health in action is immunization awareness. Over the recent years, there have been numerous campaigns against vaccinating children. This led parents to forego the standard vaccines newborns typically receive when they are born, leaving them very vulnerable to potential deadly diseases. With the anti-vaccine movement gaining traction a few years back, the public health sector had to ramp up their strategies and start campaigns to educate people on the benefits of vaccines. They also had to start to track diseases such as the measles that are starting to show up again in clusters around the country due to the lack of proper vaccination. More recently, they've started to educate people on the importance of the newly developed HPV vaccine, which can prevent cancer in both men and women later on in life. One other example of public health in action stems from the University of Nebraska Medical Center's own College of Public Health. With the help of grant funding, they were able to start a program that specializes in agricultural health education. Farmers can work in some of the most dangerous conditions that have the least amount of monitoring. The program covers all aspects of the farmer's life, from the working conditions, injury and disease prevention, and even mental health. Some of the more noticeable campaigns are the tractor safety education programs and programs that focus on women who want to succeed in agriculture. A final example of public health in action would take place in Flint, Michigan. If it weren't for the work of public health officials tracking the area that's heavily affected by the onset of lead poisoning, they wouldn't have been able to pinpoint the exact cause of the city's contaminated water and work to correct the damage that had been done by providing programs to help the residents deal with things ranging from the physical effects of drinking the polluted water to working with behavioral health issues that are encountered, such as anxiety or depression.